We've seen a spectacular opening act of Jelle Barentsz, Professor of Radiology at Radboud University Medical Center in Nijmegen, with the holograms and with the face talk. He's a well-known, highly respected medical scientist who makes full advantage of modern diagnostic and communication techniques. His main focus is to fight an epidemic of prostate cancer by the way of MRI scanning. Welcome, Jelle Barentsz.
Thank you very much.
You really touched me with your story. I got a feeling immediately, and I think a lot of people in the audience did have the same feeling, men, that their pants were too tight.
Well, you're absolutely right. I just wanted to give them exactly that impression. That if they don't do anything, their pants indeed have to be pulled off, and that they will have needles, which are not necessary. So I'm not only fighting an epidemic of prostate cancer. 1 out of 6 men will get prostate cancer diagnosed in their lives. Just imagine how many people.
1 in 6.
1 in 6, that's quite a lot.
Okay.
And the problem with prostate cancer is that the diagnosis at this moment has been done by too many needles, with an imperfect way of imaging. It is not necessary. If you use the right technology, you can reduce the number of needles and increase its yield. So the information you get out of the patient is with 1 needle better than otherwise with 12.
Okay, so you are talking in terms of warfare about this battle. Why is that? Is it so heavy?
I'd not rather talk about warfare, because if you fight a war, you have enemies, and actually there are no enemies. The only enemy is prostate cancer. It is a war against cancer, but we have to fight that just with one army, the army of medical specialists together with patients and healthcare providers. Because I didn't tell in my talk, the time was too short, but using MRI is also reducing cost of healthcare.
How? Because I thought it would be very expensive.
Yes,
MRI is very expensive.
Yes.
It's only for the happy few, the rich man, who can go to Jelle Barentsz.
Well,
Isn't that true?
That's not true. Every patient can go to our MRI. And I calculated that if you are implementing MRI at a large scale in the Netherlands, in the year 2012, that will save 30 million euros.
How?
Because with MRI you make a better diagnosis. The MRI itself is not that expensive. About 500 euros, 750 euros. But with that, you actually do a patient-tailored therapy. That means that unnecessary, very expensive treatments, like radiation therapy, which is now done also blindly, which is costing about 15,000 euros. With one MRI of 500 euros, you are excluding the need for those therapies. So it's
because of the early intervention effect, that is possible.
And also because of the fact that the information you get out of the tumor is more appropriate. So the choice of therapy is better. And if you have a better therapy choice, you have reduced cost. Nobody knows about it. But everybody thinks MRI is expensive.
Well,
no.
The image, the public image of MRI is it's very luxurious, it's expensive.
Actually, but that's completely wrong.
It's wrong.
It is affordable, it is cost saving, and every man could have an MRI like this, provided that we implement this technology as soon as possible. You only need to have a normal MRI machine. However, the radiologist needs to be educated how to use the technique in an optimal way. And also the urologist, who's referring the patient, should know about that this technique is a lot better. And we are getting there. Okay,
but it's possible to implement it everywhere in the Netherlands, but also internationally.
Yes, we
in
work
rich and in poor countries.
I think in the rich countries it's easier because you need an MRI. But if you use it very cost effectively, if you reduce the MRI time to say about 20 minutes, you can implement it also in less rich countries. The implementation is unrich way. We need to have certain things like guidelines. So we need to learn our colleagues how to do it, how to read the images. And with the electronic communication which I've shown to you, this is possible. I can learn my colleague in Moscow how to use the MRI in the right way. And I only have to show that trick to him 3 or 4 times, then he knows. Say, okay, I know how to do it.
It's no rocket science.
No rocket science, no.
Okay. How this innovation, how do you get it implemented? Who do you need? Who has to act?
Who has to act? I think the most important actors at this moment are the healthcare providers. They should loosen their ideas about their image that MRI is expensive. It is cheaper. Now the healthcare providers say no, MRI it's too expensive. But
are you a strong calculator? Can you show them some spreadsheets about that?
I just really would like to challenge them. If they want to discuss cost with me, yes, they can come to me. Also, because I'm working at the university, we are doing our cost economic studies and calculating.
You have some evidence about
absolutely.
that. Okay, and the healthcare insurance companies?
Yes, that's what I mean.
Okay.
They need to be convinced because at this moment that's the biggest barrier.
Okay, and what can the patients do?
The patients can get more empowered. Know what this technique is doing. Well, look for example at TEDx. Now they know that they only need 1 needle instead of 12.
Okay, so you can ask for it.
You can ask for it. Actually, it's very nice. We sometimes have a referral of a urologist and he said, Professor Barentsz, I'm referring this patient to you because the patient demands an MRI before my needle. And if I don't do it, he's going away.
Okay.
So the patient really is now taking over, and that's good because
is there a danger of consumerism, that people are more consumers and they really demand strongly a treatment?
I think the patient can't be demanding enough.
Okay.
The patient is always on the weak side because he potentially has a life-threatening disease, and if you have a life-threatening disease, you feel bad, you feel lower. If I would have cancer, I would feel less powerful as you, my medical specialist. So I want the patient to speak up. I want the patient to stand up against cancer, come up for their rights, and discuss with the medical specialists what they can do.
And that's about treatment, but also about health information?
Absolutely. Patients can come to me and they can ask me questions about their MRI. I will show them. I will explain them. That's what I do in, a lot of patients during the week. Rich patients, poor patients. Because I think the communication to patients is very important. That is our profession. We are medical doctors. We should care about them.
Thank you very much, Mr. Barentsz. You had a very inspiring talk, very entertaining. I just want one small question. Whose talk are you looking forward to today?
I think I'm looking forward to every talk. It's not one specifically, because every talk has its own character, its own content. And I think the diversity of this meeting is fantastic. So I will stay here until 7:30 this evening, until the last talk is over.
Okay, thank you very much,
You're welcome.
Jelle Barentsz, and have a good day.
Okay, thank you.
Bye.